Hello friends, welcome. Today in this video, we are going to listen about 6 best homeopathic medicines for cervical spondylosis. So kindly stay tuned. Before going on the topic, I'd like to share you about how the vertebral column or spine has been formed by the nature in our body. So the vertebral column we call in the Marathi Pathicha Kana, okay, also known as the backbone or spine, which consists of a sequence of vertebrae, a series of bones which is separated and united by an intervertebral disc. In the image I have showed, you can see which is the vertebrae and which is the intervertebral disc. So the vertebrae and the intervertebral disc together form the vertebral column. The major function of the vertebral column is protection of the spinal cord, which passes down the back through opening in the vertebrae from base of the brain to the end of the spine. Vertebral column is a flexible series of vertebral bones that are joined with each other to support the head, neck and body and allows for their movements. The vertebral column usually consists of 33 vertebrae. Means there are 33 bones. The vertebrae, which is nothing but a formation of bone. And in that, 7 are cervical vertebrae, 12 are thoracic vertebrae, 5 are lumbar vertebrae, and 5 are sacral vertebrae, and 4 are coccygeal vertebrae. So cervical spine. So our topic is on cervical spondylosis. Of course, we have to focus on cervical spine. So the cervical spine, as we said, consists of 7 vertebrae, that is from C1 to C7. In our medical term, for the short forms, we use the term C accordingly to the vertebral site or the complaints of the site. We name it accordingly. So cervical spine, it starts from C1 to C7. So this vertebrae start at the bottom of the skull and spread down to the thoracic spine. The cervical vertebrae close to the skull is C1 and is the smallest cervical vertebra. As it goes down to C7, get into a bigger in size. Likewise, all of the cervical vertebrae are smaller than the thoracic vertebrae. Cervical vertebrae, that is C3, C4, C5, C6 are known as typical vertebrae because they have the same basic features with most of the vertebrae throughout the spine. In between the two vertebrae, there lies a soft pad-like structure called intervertebral disc, which functions as a shock absorber, like when a person walks, run or jump. When we do these activities, that doesn't create any hurt to our spinal cord. The spinal cord is a long, thin, tubular bundle of nervous tissue, about 18 inches long, runs within the protectospinal canal, that is from the base of the brain to the end of the spine. The spinal cord serves as the transmission pathway to relay messages between the brain and rest of the body. So guys, from spinal cord, around 31 pairs of spinal nerve are emerged out and named accordingly to where it emerges and passes through the bones in the spinal vertebrae. 8 pairs of cervical spinal nerves emerge from the cervical spine, that is the neck portion, and those spinal nerves have come out from the spinal cord through the specified holes in the concerned vertebra. In that spinal nerve, if the spinal nerve gets compressed over here by any means, either by the touching of the intervertebral disc or narrowing of the passaging hole, it causes pain to those part it supplies. So we have now got the idea how the spondylosis forms, or how the structural deformity happens, and how the pain creates. Remember guys, you know gajra, okay? I'm mixing it with some Hindi words because you'll be understanding in the layman term very perfectly. So when we say like gajra, how we the gajra wala person, how he woves it into the thread, the same similar way. Remember that the thread is nothing but the spinal cord, and the gajra, that the flowers which he woves, that is the same structure what is in our body, that is the spinal cord, where the nerves are being interweaved into the spinal cord. So whenever any pathological or any structural change happens over there, the pressure comes on the nerve, and the nerves are nothing but giving the sensations, so that will create pain, and thus patient comes to us with pain at the neck, and that is nothing but cervical spondylosis. That can be done with certain investigations or with the clinical examination and with the sound clinical experience of the doctor. So yes, what are the 6 commonly used homeopathic medicines for neck pain and cervical spondylosis? So the most favorite remedy for every homeopath comes as Rustox. So Rustox is the most commonly used medicine for cervical spondylosis. The common symptoms on which it is prescribed are pain and stiffness of the part. The pain is generally aggravated by first motion, lying posture, cold damp atmosphere, and relieved by any warm application. The other symptoms are numbness or tingling sensation in the arms. Generally, the pain is more aggravated in the damp cold weather. Keeping the arm in rest position makes feel the person more pain, but movement does not have. If those are the symptoms, then Rustox will help guys. Second remedy comes, that is Semesifuga, also called as Actia racemosa. It generally prescribed when there is pain in the neck portion from overuse of fingers, like those who types in computer keyboards for long hours with an odd posture, those who play piano boards long hours, those who stitch or knit hours together. Here guys, remember, profession of the patient comes into course. So whenever taking the case history, this is the occupation where we have to ask the patient. So that will guide us to the remedy also. So there is more pain in the neck portion when the patient bends his forward or bowing of head. The pain and the stiffness is more in the shoulder areas. So the third remedy come guys is ranunculus bulbosus. So the pain is felt over the neck portion and sometimes spread downwards and chest portion too. There is more pain during the morning hours, and any short of movement aggravates the pain. Moving the head also causes pain. Even a deep breathing increases the pain. The pain is associated with numbness feeling of nerves. Why numbness happens guys? Because nerves ka kaam kya hai? To give the sensation. When there is pressure on the nerve, of course her function will get hampered. And the nothing things is like when we have the phase where we sit for a long hours, and when we get up from that position, we feel numbness in the part or tingling in the part. That is nothing but because of the neurotransmitters or the synaptic changes which has happened in the body. So you have to remember the physiology accordingly. So like Semesifuga, the pain is also originated after a long time of writing on laptop keyboard, iPad or mobile. Then comes Kalmia. It is one of the most important medicine for cervical spondylosis when the pain is associated with numbness of the part. Here, the pain origin at the neck portion and spreads downward to arms and fingers. The pain comes in paroxysmal way, not like dull persistent pain found in Rustox. There is another important symptoms found in Kalmia of vertigo or dizziness while looking downwards. So go and read BPH. That is nothing but labyrinthes. You have to go and read the word. I'm little weak in those pronunciations. So this is happens where the labyrinth in the ear gets inflamed, and when there is movement of the neck or the nerve passing over there, the person feels giddiness, especially while looking downwards. So there is nothing any magic of our remedies. That is only the physiology happening in the body. So we have to go and read the physiology perfectly and then try to apply on the patient and then try to prescribe the proper remedy. And so the two last remaining remedies is colocin. Colocin is when the pain in the cervical or neck portion which is very much relieved by pressure or massage on that area. The characteristic symptom in colocin to prescribe in cervical spondylosis is pain arise after some emotional disturbances like getting anger or being offended. That impacts in his sentiment or suppression of the anger. Those play a trigger factor to start neck pain. So mental history over here is important. And the last comes, that is calcarea phos. Calcarea phos is the remedy generally prescribed when there is any osteophytes growth on the vertebral portion due to osteoarthritic changes. Pain is more during a damp, humid weather. Along with calcarea phos, calcarea fluor also helps in bony changes of cervical vertebrae. So yes guys, this was about the 6 best remedies used in practice while doing homeopathy. And thank you for staying tuned. I hope this video will help you in guiding the cases of cervical spondylosis. If you want to have good videos on any other diseases, please kindly comment. If you like the video, please share, subscribe and like. Thank you.